My name is Dr. Adrienne Hicks, and I am an addiction psychiatry fellow at Yale University School of Medicine. I'd like to address a few questions today. The first question is, what has this past year taught you about your chosen career? Well, with the legalization of marijuana, the opiate epidemic, as well as COVID-19 hitting, I feel like addiction psychiatry is a much needed field. We all have our own stressors going on in this time during, in the community, and we all need to have someone to talk to or go to in order to get assistance to help cope with any type of illicit substance use, or just someone to talk to or get guidance to help us through this time. Next question. What advice would you give someone considering this career? The best advice I can give to someone who is considering a career in addiction psychiatry is to have patience. Like I said, with all of the different things going on during this pandemic, during a time in which we are trying to legalize a substance that has known side effects, as well as the opiate epidemic that we're dealing with, there are so many things that people need to unleash off of themselves. And we can't force anyone to deal with these things in our time. It has to be about the patients. And therefore, when patients are ready to engage in treatment, we need to be there. And we need to sit back, listen, as well as take in whatever that they're saying or they're expressing in order for us to be our best selves in order to help the patient. Next question. What health advice would you give to underserved communities right now? With the COVID-19 pandemic going on, one of the best advice that I could give to anyone in our underserved community is to bond together. We need to be there for each other, because even though we may be at home in our own individual spaces, we need to come together to just let everyone know that we're still one community, that we're still one world, we're still one state of mind in which we still need to depend on each other. A lot of businesses have suffered, a lot of people have had losses in their own families. So I don't know if you've ever seen the commercials where people knock at the window and wave to the people or wave to an elderly person who may be inside. Or you've seen the commercials where people drop bags of groceries outside. One thing that I would definitely say is reach out to our elderly, underserved communities and just let them know that we are still here. And if you need anything, let me know how I can help. I may not be able to physically come do something for you. Maybe I can order something for you via Uber Eats, DoorDash, or just come knock at your window and say hello. We need to stick together. That's the best advice I can give. Next question. What are your thoughts on preventive health care and the importance of having health insurance amid the ongoing pandemic? Wow, that's a good question. With the pandemic going on, I feel like health insurance is a must, because a lot of services have been shut down or discontinued during the pandemic. A lot of doctors' offices have been closed and have turned to telehealth, in which patients are seen by video or telephone. So it makes it a lot easier for patients if they already have health insurance and they just pay the copay at a much less price than a cash visit. And if you do have to go out for labs or any other kind of test, then you'll just have to pay the basic rate versus the high cash rates. And you won't have to worry about, oh, I can't be seen until I have the money, and then insurance companies can work on your behalf. Another time in which you feel like you're not alone. You have someone working to help you, to work with you in order to get the services that you need during this desperate time. Again, I am Dr. Hicks, an addiction psychiatry fellow at Yale University School of Medicine.